Historically, breast cancer surgery was amputation. Basically, we have moved from there to breast conservation as the gold standard of care. I think that's still an important goal in addition to providing cure for our patients. Obviously, we want to do so in preserving their physical integrity as much as possible. And for the surgeon, that means preserving the breast. I think strategically we have learned a lot, both in terms of surgical technique, but also in terms of changing the order of treatments, such as bringing the medical treatment before the breast surgery itself, shrinking down the tumor, thus enabling breast conservation in situations where previously mastectomy would have been the case. But I still believe it's an important goal that remains to eliminate mastectomy eventually. Well, when you ask patients before the treatment, what do you want? And obviously the first thought is, I want to be cured. And fortunately, we can achieve this nowadays for the majority of breast cancer patients. But in addition, we want to keep our treatments as, let's say, acceptable as possible. That means side effects need to be controlled, impacts on quality of life need to be alleviated. And in terms of breast surgery, that obviously means avoiding mutilating amputations, because quite obviously the aesthetic and physical appearance, continuation of integrity of a woman's body, these are also very important goals that never should compromise the cure aspect, but in most instances nowadays they can be ideally combined. Examples of surgical de-escalation, in addition to moving from mastectomy to breast conservation as a standard of care, mainly means in recent years the different treatment of the axilla. Under the armpit there are lymph nodes that used to be removed for diagnostic purposes, which historically had some adverse effects like lymphedema, swelling of the arm, sometimes while achieving cure, impairing our patients' quality of lives for good. And we have moved away from doing that to a more selective approach, where this is called the Sentinel node procedure. So we just take one or two nodes, check them under the microscope. If they are okay, then the remaining lymph nodes can stay in place. And meanwhile, even in some situations where certain of these nodes are affected by the disease, we have developed techniques and strategies to leave the axilla alone to avoid surgical complications. Well, I think that the goals of breast cancer treatment in general is cure, preservation of quality of life, eventually just getting rid of the problem. And that's fortunately possible now for the majority of people affected with the disease, which is quite different than the perception and expectation. So I think one of the most important jobs that we have, particularly in the beginning of the interaction, is to take away the panic, to try to alleviate the fear, to be realistic on one hand, but also optimistic, because there's reason to be. The majority of patients being affected with breast cancer nowadays will die from something else, which is the ultimate definition of cure from our perspective. So I believe that finding that balance between, yes, there is a problem, we need to do something, we need to be mindful, but also, yes, it can, for most cases, be resolved. And even when you are at an advanced stage of the disease, nowadays that means that you can still live for many years and live well. So I think we can have a rather optimistic outlook into the future. I think in terms of the future, we will see further improvement in our ability to tailor the treatment approach to the individual. Yes, we might find situations occasionally where we can avoid surgery altogether, which is a little bit like a fashionable goal. From a patient's perspective, actually that's not a high priority. I mean, breast surgery nowadays is almost without complications, can be done on an outpatient basis in many situations. So the impact on the quality of life is actually limited, and I think that it will probably stay there where it is. However, understanding better who needs more and who can be effectively treated with a little bit less, as for surgery, as for radiotherapy, as for medical treatment, so further individualization is the most important priority for the immediate future.